what is going on before that you have hypertension. Then added to that, it's important to let you know that regarding this hypertension, in as much as it's global, of course, we know industrializations response. You and I find ourselves in a setting where the political will and interest in the health of the population is quite global. So, low and middle income house continues to suffer the burden of inflation. So, we proceed talking about hypertension by looking at the learning objectives in this hour's instruction tonight. We want to understand the body impact of hypertension. We also want to recognize early warning signs and risk factors as well. Sorry, I'm trying to share the slide proper. I'm sorry, just give me a few seconds. Let me start from hands in the use of pages. So try to as much as how we can go over the points. Be more particular information regarding that is not focusing emphasis on the lifestyle issues and
We can't hear you, Prof. We can't hear you.
oh, you can't hear me now. Hello, can you hear me now?
Yes, we can hear you.
Now,
Sorry.
yes, but initially, no.
Oh, I'm sorry. Please, the thing is, because I'm on the slideshow, I cannot really speak any.
It's breaking.
Hello, someone's.
It's breaking. I said the volume is breaking. That is, your voice is coming in break.
Is it better now?
Yes, it's better. I think it's better now.
Are we?
Yes, I think it's better too.
All right. So let's talk about hypertension itself. What is it? Hypertension is a persistent elevation of blood pressure above normal range. Just so that all of us can understand what we are talking about, it has to be that another word for hypertension can be called persistently elevated blood pressure, or some people call it high BP, high blood pressure. What does that mean? Of course, we know that the heart pumps blood through the arteries to the rest of the body, and so there's a certain pressure that this particular blood needs to flow to ensure that all parts of the tissues in the body gets blood. But there are times whereby the blood flowing through the arteries begins to hit the walls of the artery much more than it's supposed to be. At that point, now see there is high blood pressure. And so, in trying to state what high blood pressure is or hypertension, it has to be persistent elevation. The reason is that there are times whereby, because of one factor or the other, maybe pain, stress, or anything, the blood pressure could transiently get high. Whereas at other time you check it, it's normal. So that thing cannot be classified as hypertension. So we only use the word hypertension if we check, after some time we check again, we're still getting blood pressure higher than a certain threshold, then it is agreed that this person has hypertension. So it's a condition or diagnosis that has to be carefully considered and before we label someone hypertensive. So that brings us to, okay, what is normal blood pressure? Normal blood pressure, roughly from different guidelines available, is within the range. And the range is normally blood pressure we have what we call systolic and diastolic. That's why it's usually written something over something. The millimeters of mercury. So the normal blood pressure is systolic of 90 to 120, but diastolic of 68. I repeat, 90 to 120, but diastolic of 68. And systolic pressure more like records the pressure of the blood flow in the artery when the ventricles are pushing blood away from the heart. While diastolic records that when there is filling of the ventricles. Alright. So moving away from there, want to understand the fact that this blood pressure elevation we're talking about, called hypertension, is actually a major risk factor for conditions like stroke, heart failure, kidney disease, and even death. Oftentimes, it is called a silent killer. The reason is that when the BP is elevated, most times it doesn't give us any sign. I repeat, most times it does not give any sign or symptom. So that is why it's a silent killer. Meaning that something can go wrong without the hearer of the body. So it's a silent killer. That is the reason why early detection is very, very important in preventing long-term complications. Now, why does it matter? Like we've been saying, it affects millions worldwide, including young adults. Many patients remain undiagnosed or falling from more because talk about the complications. Heart, brain, the kidneys, and the eyes. The lifestyle factors play a major role in prevention. Let's talk a little about the etiology, that is the causes of this hypertension, because a lot of us want to know, why do I in the first place have to have hypertension? The truth is that in trying to find out what causes hypertension, there are two types you have to consider. There's one we call primary or essential hypertension, one that 90% of people have. But unfortunately, there's no known cause for this. There's no identifiable cause for why this person should have high blood pressure. So we call those category primary hypertension. And it's very common among those who are aged, like 40 and older. Then secondary hypertension affects 10% of people generally. But for this, it has identifiable cause. That's why the name is secondary, meaning that it's secondary to something else. And what is it secondary to? It could be secondary to renal disorders. By that, we mean something like kidney failure. For example, kidney failure patients, most of them come down with high blood pressure. Then we also have vascular disorders. Those ones can also cause high blood pressure. Like there's a condition called coagulation of the aorta and the rest of them. So conditions like that causes high blood pressure. Then we have endocrine disorders. Most of them, like the Cushing syndrome, talk about the pheochromocytoma and the rest of them, they also come with high blood pressure. Then there are medications that are also known to cause high blood pressure. People that take cocaine is a good cause. Even alcohol misuse. It has also been discovered that some of the routine drugs, even sort of NSAIDs, that's non-steroidal anti-inflammatory drugs we take, sometimes it's under hypertension. These are what studies have. Now, because we said for the majority of the cases of hypertension, we have 90% of them, there are no identifiable causes. So at that point, what becomes more important is for us to consider, okay, what are the risk factors? What are the things that can trigger an individual to have hypertension? We call these risk factors. And these risk factors are subdivided into modifiable and non-modifiable risk factors. I would like to talk about the non-modifiable risk factors first. Non-modifiable means if the risk is there, it is there, there's nothing you're going to do about it. Nobody can change it.
Good evening. Wow. What does in fact this Otija Shagata was this surprising. All the same PM name approve all this thing before. So mana even one car okay me only approve. Okay, me only 5 million people pay for this one. I want to 5 million get paid before her. Wow. I think another FC yoga. Sure, now they all of the same. All the same portfolio manager also now they can approve.
Before you start thinking about the possibility of developing hypertension or that. However, for those who have persistently elevated blood pressure, they can also have symptoms like persistent headaches. They could have dizziness. They could have blurry vision. They could have chest discomfort. They could have palpitation that is heart racing. They could also come with shortness of breath. Some could come with fatigue and reduced exercise tolerance. But one important thing about these symptoms mentioned here are actually signs that the hypertension is becoming quite severe. So, like I said earlier, we do not have to do it. Why some patients worsen despite medication? Some people on antihypertensive medications, and yet it looks like they are not progressing. Things are not. One of the factors is poor medication adherence. People might not be very serious. That's a very important factor. That is why we did that number one in this life. Another is excess salt. I'm going to discuss about this. Physical inactivity, based on a healthy diet, excess alcohol intake and smoking, force and unmanaged stress. Then let's talk about lifestyle habits that help control blood pressure. One is regular physical activity. Regular physical activity is very important. And if being called regular means it's not something mechanical once in a while. There are some persons, you ask them, are you physically active? They say, well, why not? Why not the one that take care of the children in the house? I take care of my shops. But look, I do a lot of work. That's not regular physical activity. The regular physical activity is a programmed activity whereby consciously you make out time at certain times of the day and carry out exercise. That way, you can call it regular physical activity. And there's a time duration attached to it. From WHO standard, that's World Health Organization, every adult should embark on moderate intensity physical activity. And that means you need to give out 150 minutes of your time exercising on a daily basis. Divide that by the number of days you have in a week, which is 7. Realize that in 30 minutes every day for 5 days. And so that's sufficient. The best you can do, if you can have 2-3 days, do that consistently. It's important. Like we said, moderate intensity. Something as minimal as brisk walking, very important. It does not have to be doing strenuous work, running extensively. Because one thing you want to consider is it's important that as you start to sustain it. Then we'll talk about weight reduction where necessary, or which exercise also your diet. You have mentioned healthy eating patterns, reducing processed foods and excess salt, adequate sleep and stress reduction, avoiding tobacco and limiting alcohol. I'm trying to go around because I know that there's going to be wasting on time, so I don't want to say all you wanted to ask. All right. Then we'll talk about salt, stress, sleep, and exercise. Be more like what we said earlier. Excessive intake of salt contributes to risk. That is because, of course, through the principle science of biology, we know about osmosis. Once you have so much of salt inside the blood, it increases the hydrostatic pressure. That begins to draw water into the vessels in the vascular flow, thereby increasing. That's why excess salt actually raises the blood pressure. Stress. Chronic stress may worsen hypertension control. Think of it this way. Imagine if somebody shouted in the office where you're working, there is fire out there. Trust me, at that moment, you be panic. Anybody checking your blood pressure at that time is high. The reason is that your stress hormones has been elevated. Cortisol, even adrenaline, they've all gone up. And that is trying to prepare you to face the danger that is before you. But then think of it, just imagine that for the next 3 months to 6 months, every day of your life, you're having situations like that, stress. And then once it becomes chronic, then that gives you hypertension. So you want to consider all of that. And living a stressful life that just fueled the process that makes hypertension develop is poor sleep and to increase cardiovascular risk. Hypertension is very high on cardiovascular parameters that goes high when the one does not get sufficient. Stated by Dr. that sufficient sleep you're giving yourself a minimum of 7 hours of sleep every night. Exercise, I've talked about that 150 minutes of moderate intensity activity weekly. Then plant healthy foods. Want to ensure that we consume fruits and vegetables, whole grains, beans, nuts and legumes, fish and lean proteins, reduce sugary drinks and fried foods, and adequate water intake. All of this put together is what we call DASH diet. That DASH means dietary approach of hypertension. Now here mentioned lean and fish and lean protein. The lean protein here, a good example is your chicken, skin, and the lean piece. So all of that. So that is what they call DASH diet. And they helps. Monitoring blood pressure at home. That's another very important thing because blood pressure has a chronic behavior. It's not something that is constant. Like I did say earlier, when you are subjected to stress, pain, or any other thing, your blood pressure will be. So based on that, you want to make sure that make it a habit to monitor blood pressure at home. And in doing that, don't just monitor blood pressure anyhow. There are some things that checklists in order. One is use a validated BP monitor. Ensure that the machine you are using. Want to rest for 5 minutes before checking. Want to ensure that you're sitting comfortably, your hand well supported. Then before taking your blood pressure measure, do not take caffeine, which you found in coffee, and do not exercise just before blood pressure measure. It's going to affect the patient. Then of course you want to take multiple readings and then take an average. So there's a concept known as home blood pressure monitoring. That concept became necessary because of what was known as white good hypertension. There are some persons when they get to the hospital, by the time they see the nurse is wearing a white, their mind goes up. So when you take a blood pressure, they are getting high. And that will not be representative of the true state of their blood pressure. So based on that, it becomes necessary that an individual checks his BP at home. But if you're checking your BP at home, once you can see a disparity of up to 20 millimeters of mercury for the systolic or 10 for the diastolic, different from what you get in the clinic or the pharmacy. Possibly that is quite. On the other hand, there's also something called maxed hypertension. Somebody can just get one high BP at home from the machine and assume that BP is high. Whereas coming to the clinic, it takes time, relax you and check your BP and notice that nothing is happening. That concept also happens. So that is why we want to be sure that we're doing it properly, so that we do not erroneously label someone hypertensive. All right. So we talked about prevention strategies, routine blood pressure screening, healthy lifestyle for the young age. We do not need to wait until we are 40 and we begin to apply all the advice regarding that. A couple of times people come to the clinic. I've seen people that come to the clinic are asking the heart problem, some have kidney issues. You see the relative asking what kind of food should they eat and should they not eat. So sometimes to me it looks like a missed opportunity because most of those advices we give to people about what to eat or not when they are now sick is something that should have taken a right from when they were even at the age of 20 or thereabouts. Yes. So that is what we want to do. We don't want to wait until we are sick before we start ensuring that we live a healthy lifestyle. Then another thing is family awareness and education. Like I said, the focus in the society is about the other prevalent illnesses. We have been knowing that cardiovascular disease is actually number one killer disease. Then regular medical follow-up for high-risk individuals is important as well. Community engagement and health promotion. This we can do in schools and different outing areas to inform the people about. Now, these are the takeaways. I was told that this was probably sorry, I've already run it. Hypertension is preventable and controllable. And lifestyle changes are powerful alongside medications. Early detection saves lives. They want to also know that small healthy habits leads to long-term benefits. Something very important is consistency. At this point, I want to say thank you all for listening and
Thank you so much, sir. Thank you so much. It's a very informative one.
over to the moderator.
Yes, sir. Thank you, sir. Can you hear me? Can anyone hear me? Can anyone hear me?
Hello, can I be heard?
Yes, sir. We can hear you, sir. Okay, thank you,
Okay,
sir.
thank you, sir. Thank you, sir.
Thank you very much, sir. So can I be heard? I believe you can hear me. Okay. All right. Thank you, sir. So we'll be going into the question session. We have some questions here. We have some questions for our speaker. So I'm going to let me open this my slide where I have the questions. I can only share my screen. Okay. Okay. So we have these questions. So hello, sir. The first question we have is why is hypertension often called a silent killer? Because most of us are aware with the term silent killer. They always say hypertension is a silent killer. Please, sir, can you give us the reason why medical people call it a silent killer? Thank you.
All right, thank you. Um, that's a nice question. The reason why it is called a silent killer is unlike some other illnesses of acute nature, once they come to you, you have the impact immediately. So you're sick, even yourself, you're having symptoms and you want to address it like what are the case of hypertension? It gives you no sign at all. That is why it's called a silent killer. So meaning that things are going wrong in the organs, the eyes are being damaged, the teeth being damaged, without the person that has hypertension. A lot of persons come to the clinic with one sudden illness. They say, oh, he was somewhere and felt like fainting. That's why we rushed him to the hospital. By the time you are not checking the blood pressure, you are seeing someone having a blood pressure of about 180 over 120. I'll be like, madam, how can you tell us that we don't know this person has this? Doctor, we don't know. So I'm just trying to dramatize it. That is why blood pressure is called a silent.
Okay, thank you so much, sir. I think now it's clear to many of us to know that hypertension is actually a silent killer, not just that they said it's a silent killer. So the second question is, in our society now, it's called a fast-paced society around the world. So in today's fast-paced lifestyle, what everyday habits are quietly increasing the risk of hypertension among young adults and working class people?
Thank you very much. Like, let me pick that phrase, fast-paced lifestyle. Yes, that is the situation we find ourselves unfortunately. And so because it is fast-paced, we do not have time for our age-old natural lifestyle habits. Take for example, sleeps up to 7, 8 hours. It is when they are hustling to meet up the requirements of the work. Then talk about the diet. Some persons are in hostels or in some sort of accommodation or areas where they don't even have time to prepare their meals. So they go for fast food. And then some persons do not even have time to exercise. There are some persons that the kind of work they do requires that they are sitting at a point before a computer from morning till evening. They have targets that their institution has outlined for them to meet. These are many more. When you put them together, you realize that these are habits that are somewhat contributing to hypertension. Then, added to that, among the young ones today, there's also those who indulge in sort of over the fence medications, that is the hard drugs. All of those things contribute to that.
Okay, thank you so much, sir. So, to the third question, if someone in their 20s or 30s look healthy and exercises occasionally, do they still need to check their blood pressure regularly? You talked about home-based blood pressure monitoring. So, if someone that looks healthy, exercises regularly, and all those healthy lifestyle, they still need to be checking their blood pressure regularly.
I answer with a resounding yes. The reason is that even though you're in your 20s and 30s and you're looking healthy, don't forget that word looking healthy is a subjective assessment. Somebody looked at you and said you're looking healthy. It's even in WHO definition of health. After saying all of that, the absence of this and all that, after saying the state of physically, mentally, spiritually, some people even have financial well-being, then I say not just the absence of health. So that simply means that no human being today can be said to be 100% healthy. Everybody is apparently healthy. So that you're looking healthy should not make you go home, relax, and say you are healthy. And like he also said, occasionally exercises. That wouldn't be the key word. It's regularly exercises. So I would say that those persons should check regularly. But the only thing is that based on this age bracket, regular check will not be the same for those who are up to like 60. Those in their 60s and 50s can do much more regular. But they themselves, at least, it might not be like once in a month. At least once in a year or more, you can check your blood pressure. And if you're lucky to have the machine at home and you're doing nothing, it costs nothing for you to check your blood pressure.
Okay. Thank you, sir. So, to the next question, that's question 4. What common everyday foods or eating habits may unknowingly be increasing blood pressure in many homes.
Okay, do I touch this slide? Of course, I'm also try to answer it partly when we talk about the fast-paced life. Today, there are a lot of things we consume as foods that actually increasing our risk of developing high blood pressure. One of them is eating a lot of fatty foods, taking meals that have so much salt in them, then not giving more attention to the fruits and vegetables, and then also overly eating processed foods. In the era, we have a lot of things like the macaroni, the indomie, the noodles, spaghetti, and the rest of them. They are all over the place. These are processed. We want to make sure that we limit their intake because all of these put together increases our risk.
Right. Thank you so much, sir. So the next question is what are some simple, affordable dietary changes families can start making immediately to support healthy blood pressure? What are some adjustments we can make in our daily dietary patterns to support a healthy blood pressure?
Okay, to support a healthy blood pressure, both for those who have it and those who do not have it as a form of prevention, there are very simple meal plans and changes of which if you need more information, you can also liaise with some dietitians, some experts on nutrition. But speaking generally on that, uh, making sure that we have more of vegetables and fruits predominant food is important. Then want to also cut down on fatty meals. Want to consume more of legumes and proteinous food. And then when it comes to the protein, want to go for the lean meat, like I did mention earlier, the white meat, which in our environment, the one we can easily mention, chicken without skin. Then we'll talk about the fishes as well. Then in the cooking style as well, emphasis should be away from excessive frying. Go more for boiling kind of cooking, which our grandmothers of those days did in the villages. And what's
Yeah,
more, another thing is eating
too much of
time.
frying.
Want to also reduce the amount of calories we take in the evening hours. There's an age-old adage that
Evening time,
says,
it's
in
not
the
eat
morning, eat
calories.
like a king. In the afternoon, eat like a prince.
Yeah.
In the night, eat like a pauper.
In
It's
the
very
morning,
important
eat like a king.
that our
Afternoon, eat
evening
like a
meals should be
prince.
very
In the
light
night, eat like a poor man.
and we should take it early enough.
Yeah.
Anything later than 6 p.m. is not good because from the time you're taking your
This is
dinner
a very
to when
senior
you
doctor
are going to bed,
for
there should be about 4 hours gap. Take note of that. So all of these and other things I do not remember now include the things we can do at home, including reducing salt intake. Very, very important.
reduce salt intake,
Over there in the Western world,
hypertension.
they have their formula, 2 grams and all of that, but that's not very practicable in our setting. The best you can do is to make sure that you do not add extra salt to the meat that you're being served, and the person preparing should not also be so conscious of adding so much salt. But there's something I usually tell my patients. I say the salt level in your food should be in such a way that if someone else comes to taste your food and complains, it's like there's no salt in it, then you are there. It doesn't mean salt was not used in preparing it,
When someone
but there
complains
is
that
that
your food
is
doesn't
not
have salt,
really
that means
remarkable.
you put the
So these
enough
are the
salt.
little things that can be done to ensure that we have healthy meals that is affordable and also help us to control blood pressure.
Okay, thank you, sir. What I got from this now is if someone complains that your food doesn't have enough salt, just know that the salt quantity is enough for you. So it's a very powerful message. Then, question number 6: how does stress, constant worry, or emotional pressure affect blood pressure, especially in today's always busy world?
Very important. Stress, the factor regarding blood pressure in the long term. Like I did say, I used the scenario where in the office and somebody shouts fire outbreak. Trust me, at that point in time, you panic. everybody will be running for their dear lives. The adrenaline, all the hormones that help to fight stress, all form of cortisol. But when it now becomes constant, that at every point in time we are being subjected to situations like that, it's a serious issue. To tell you the truth, stress has been linked to blood pressure because, like we said, it's a silent killer. Somebody might be having some kind of lower stages of the high blood pressure, but with the incidence of stress, it's up. And this stress can come in situations that makes you angry all the time, outburst of anger. It could also be some unhealthy relationship that has not been settled over a long time. It could also be excessive work stress that one has not been able to create a balance. So all of these contributes to high blood pressure in the long run because of the effect of the stress hormones.
Okay. Thank you, sir. Question number 7. Can poor sleep really affect blood pressure and heart health? I know you talked about stress. You answered that in the previous question. But can poor sleep really affect blood pressure?
Yes. There is one thing about sleep that a lot of persons have not understood. We just see sleep as something that happens and everybody sleeps. But that is a natural uh, control measure. I don't know how to describe it again. For that word. Kind of something that helps the immunity that God has created. Just see the body as a factory that has so many constituents in it. We have different systems running concurrently. A lot of waste are being generated, and some of these waste are not the type that can easily expel. Some of them come in toxic radicals. They are more like ions that they stay in the cells. It is the sleep that helps us expel so many of them. So sleep actually helps us to relax the body. The body has been working tirelessly. It helps to ease the process of aging. So when one is not sleeping, stress builds up. All the toxic radicals are not resting. And then it promotes cardiovascular diseases. And one of them is hypertension. Studies have overemphasized them. And that is why currently those who design the pillars of lifestyle medicine has coined the word known as restorative sleep. So sleep restores the body. So restorative sleep is one of the 6 pillars of lifestyle.
Okay, thank you so much, sir. Restorative sleep is very important. Question number 8. For an average person, what type of physical activity is actually enough to help control blood pressure?
I talked about moderate intensity exercise. Sometimes people feel that they must have to go to the gym and do everything, eat what they eat in order to get their adequate body size, and that will help them sleep that well. Well, that's commended. But from the level of what you understand, once you can have moderate intensity, something as little as jogging or taking brisk walking. And what's brisk walking? You are walking, but you increase the pace of your walking. You can walk from one side of your compound to the other, increase the pace. If normally it takes you 100 steps to come from one side of the compound to the other side, and you want to do that in 36 steps, and you do it consistently, that should constitute uh, enough exercise to help with blood pressure control. And what to be careful about is that all of these lifestyle measures work in isolation. As you are also working on the exercise, you are putting in the aspect of the good nutrition, you are controlling your stress, sleeping adequately, avoiding harmful substances. Put this all of them together, it really helps with blood pressure.
Okay, thank you, sir. Um, Question number 9. This is the second to the last question. Then we will take from the chat box, and any other person that has questions should raise their hand So, question number 9: what should people know about checking their blood pressure at home correctly, and when should they become concerned?
Okay, very important. From start, checking correctly is important. And one of the first things that you want to ensure is to ensure that the machine you are using is well validated, is working properly. There are different kind of blood pressure checking kits. You have the standard checking kit that usually see what they call it, the clinics. You also have the RNO that is at least like a small watch. That one is more like it's the portable. Then you also have the digital. All of them, so far as they are well calibrated, they are good to go. You want to use them properly. And then of course in checking that blood pressure, you want to make sure that you rest properly. Even of 5 minutes seated before checking. I want to ensure that when we are sitting for blood pressure, you should be comfortable. And for you to get an accurate reading, please ensure that your arm where the blood pressure cuff is applied is at the same level at your heart with your heart. I repeat, the arm where they are applying the cuff for the blood pressure is at the same level with the heart. And that is why the left part of your hand is preferable. However, you can still get a good result with the right as well. Right. Then of course avoid exercise just before checking your blood pressure. I want to also avoid taking substances that can increase the blood pressure, like caffeine and other offensive substances. Then, when checking blood pressure, sometimes they vary. Experience has shown that the first one you check sometimes will be different from the second one and the third one. So, doctor person recommend that
The
you can
two
do
next one.
checking three different checkings, and then take an approximate value. That way, you can record it somewhere. And regarding the home monitoring of the blood pressure, sometimes when you go to the clinic and you get the high blood pressure, this is something like usually I didn't mention that you can actually label someone hypertensive if the BP checked in the clinic is 140 over 90 or above. That's the range for hypertension. But at home, 135 over 55 is considered high blood pressure. Home blood pressure 135 over 55 is considered high blood pressure, but in the clinic 140 over 90 and anything above that. So once you get a value in the clinic at that level, let's say for example you went to the clinic for the first time and they check your blood pressure and it's about 150 over 90. Nobody should be so much in a hurry to commence your medications. Instead, you can be placed on a regimen of lifestyle we discussed, and then ask to do a whole blood pressure monitoring and come back to the clinic maybe in 2 weeks' time so that they can see the records and take a decision on if there will be needs to go to the next level or to sustain treatment regimen, which is lifestyle. More often than not, sometimes people come back with a record that shows that it has been normal all at the home. So based on that, that is what it means to do with home blood pressure monitoring. In some localized situations, they have what we call ambulatory manner blood pressure monitoring, whereby the cuff is in your hand and there's a monitor that is checking it within 24 hours. But when we find ourselves, that might not be quite possible because of technology. So a very close alternative is pump blood pressure monitoring, whereby at least twice a day for up to 4 days, or up to 1 week, and then bring the record into the clinic. And then the health workers will assess it and continue the management.
Okay, thank you, sir. So the last question, yeah. Okay, I think let's go to the comment session and take the questions there before we take our last question from our slide here. So one of the questions asked here, someone asked, does stress cause high blood pressure, and how can someone manage stress? I think we've answered that. I think that has been addressed here already. You can, okay.
usually have is primary hypertension, understand? So all this, most of this information may not be the best cause for this family, understand?
Okay, sir. Yes, sir.
So these are
There is
things
factors.
that can lead. So not that once you are having stress, by the next 1 month you must have blood pressure.
Okay, thank you, sir. Someone said there that I started with PIH, that's pregnancy-induced hypertension. I started with PIH during pregnancy in 2010. Until date, my blood pressure has been high. My question is, should I stop taking my drugs if my BP seems low at the moment?
Sorry, I got the call from your saying something seems low at the moment.
Okay, sir. Let me take the question again. Okay. He said I started with pregnancy-induced hypertension during pregnancy in 2010. Until date, my blood pressure has been high. My question is, should I start taking my drugs? Should I stop taking my drugs if my blood pressure seems low at the moment? So she's asking if she should stop taking her drugs if her blood pressure comes low.
Alright, thank you for that. The thing is, it's quite unfortunate. I'm sorry for her. Pregnancy is important. Not the best time I've seen that. Alright, but then the thing is that one thing about health is we need to be careful about accepting our status. If you accept your status, you can't improve or surrender without control of any health. First of all, you have to first of all accept the fact that now you have hypertension. You have primary hypertension. It's not a doubt here. She has hypertension. Hypertension is one illness that it's not like malaria that it is there, it is there. What we need to do is control it and ensure that it doesn't cause complications and all of that. That minimize the risk of complication. So coming to our question, I would say they stop if the nothing just seems to do. That statement sounds a bit slimy because that word seems to do. You have to be very, very careful with it. What value the sheep is. And then for something that the whole lot of trust me, that is taken by myself. You need to mission how to take that decision. Definitely, I would have said you shouldn't stop taking a blood prescribed blood medication prescribed for hypertension. But even if such is not taken, not by her, but by the person's mind.
Okay, thank you, sir. We have someone that raised their hand. Ada Samuel, please, you can unmute and ask your question.
Good evening, everyone. My name is Adam. Please, I want to ask, is it that in pregnancy, even with the maximum dose of antihypertensive drug, the BP still goes high and high and high?
Pregnancy progresses. Hello, can you hear me?
Yes. Are you done with the question?
Yes, I said, why is it that in PIH, instead of the blood pressure to come down, it will just be going high and high and high, even with maximum dose of antihypertensive. As the pregnancy progresses, it doesn't come down. Instead, it will be getting higher and higher.
All right. Thank you for your question. The thing is, we need to understand the nature of hypertension in pregnancy. The truth is that hypertension in pregnancy is actually not a favorable medicine like men, so to say. That's why some people call it spontaneous pregnancy. It's heading to somewhere, and that's why it has to be controlled. It's a problem arising from the placenta, even though it's not very much understood. I, as the pregnancy increases, but as the pregnancy is aging towards the baby, that is how the blood glucose is going high. And despite the treatment, we still have that kind of issue whereby what you do to something. But the family still have to be one, the condition, based on the condition can make increase. The whole thing will step down one day is happening. Once that baby is out of that, it's going to be popping up. We have some lessons on what to do. Even after the person for a while, because the later, it's not because the risk for them hello, I want to tell them.
Yes, sir. I hear you, sir. But there is a noise at the background from your background, sir. Okay, so let's take the last question. If everyone attending this webinar decided to change just one habit this month to protect their blood pressure and heart health, what habit would make the biggest long-term difference? Okay, diet. Okay.
That is one thing that advance of the process. The person fast like so much more attention. And then adding to that, I also talk about diet. Unlike it is, we don't have the number of fast foods as around us. And the things they prepare there, a lot of us feel that the more you put fast food, that's the way you feel that sound and use fast foods appealing to the tongue and not to the health. So that is why diet. Don't stay away from that. Even the sign of that's that is
Okay, thank you so much, sir. I think we've come to the end of today's webinar. I must really appreciate our guest speaker. Our guest speaker has really done very well this evening in enlightening us about hypertension and how to manage hypertension. Thank you so much, sir. We really appreciate your efforts and the time you created to give us this wonderful lecture and answer our questions. So, if your hands are not busy, please can you show some love to our guest speaker, Dr. Mvarie Fidelis Eze. He's a senior resident doctor at the Federal Teaching Hospital, Owerri. Thank you so much, sir. We really appreciate